Hello everyone, I welcome you all, my dear students and my viewers. Today I would like to speak on hydronephrosis. Hydronephrosis is a aseptic dilatation of renal pelvis and calyx with accompanying destruction of the kidney parenchyma. It usually occurs due to partial or complete obstruction to the outflow of urine. Causes of hydronephrosis could be congenital or acquired. Congenital causes are atresia of urethra, aberrant renal artery compressing the ureter, renal ptosis with kinking of ureter, and acquired causes can be stones, tumors like cancer prostate and bladder tumors, inflammation like prostatitis, urethritis, and neurogenic causes like spinal cord damage with paralysis of bladder. Hydronephrosis can be bilateral or unilateral. Causes of unilateral hydronephrosis are extramural, intramural, or intraluminal. Causes of extramural unilateral hydronephrosis are when there is pressure on the ureter by loaded sigmoid colon, gravid uterus, uterine and ovarian tumors, when there is involvement of the ureter by malignant neoplasm outside, example carcinoma of the cervix, uterus, colon, rectum or prostate. Aberrant renal vessels can also cause hydronephrosis, and retroperitoneal fibrosis can also lead to hydronephrosis. Causes of intramural unilateral hydronephrosis includes congenital stenosis, ureterocele, stricture or neoplasm of the ureter. Intraluminal causes of unilateral hydronephrosis are calculus and congenital folds at the upper end of ureter. So renal calculi is the most common cause for hydronephrosis. This is the picture showing bilateral hydronephrosis and unilateral hydronephrosis. Causes of bilateral hydronephrosis can be some pathology in the urethra or bladder. So causes in urethra can be PPH or carcinoma of prostate, congenital valves, stricture of urethra or carcinoma of cervix or carcinoma of uterus. Causes in bladder can be calculus of the bladder, neoplasm of the bladder or sphincter dysfunction. Signs and symptoms. Many times patient is asymptomatic and there is dull aching pain in the loin area. Pain is felt in the renal area along with hematuria, anuria, oliguria, urinary infection, dysuria or frequency of micturition. There could be history of calculi, azotemia, unexplained GI symptoms. There is some large hydronephrosis can be palpable. Along with there is distension of bladder if the urethra gets obstructed. Morphology. The kidney is massively enlarged with greatly distended pelvic-calyceal system. The renal parenchyma is compressed and atrophied with obliteration of the papilla and fattening of the pyramids. Depending on the obstruction, one or both ureter may also dilate, hydroureter. Normally the urine flows through the urinary tract with minimum pressure. Obstruction in the urinary tract can build the pressure, and that will result in enlargement of the kidney, hypertrophy. Kidney become bigger and with urine that it presses against the nearby organs. If left untreated, the kidney loses its function. So the stasis of urine will result in pressure, back pressure. Macroscopic changes. Pyramids of medulla of kidney suffered. Cortex of kidney becomes involved. Calyx are blunted and gradually they distend to destroy the substance of the kidney, so parenchyma will get disturbed. Gradually, the cortex thin to mere a shell. That's how the destruction of renal parenchyma will occur. Investigations. Urine analysis is done to look for blood infection or abnormal cells. So elevated blood urea and creatinine indicates renal dysfunction. Complete blood count may reveal anemia or potential infection. Electrolyte analysis may be helpful in chronic hydronephrosis, since the kidneys are responsible for maintaining and balancing air concentration in bloodstream. Beside this, intravenous pyelogram is very good investigation. It will detect the dilatation of renal pelvis. A dye is injected and X-ray is taken. Other special investigations include excretory urography, retrograde urography, and ultrasound. X-ray KUB. KUB X-ray will show the kidney, ureter and bladder, and it is used by some urologists to classify a kidney stone as radiodense or radiolucent, and may use KUB X-ray to determine if the stone is able to migrate down the ureter into the bladder. CT scan of the abdomen can be performed to evaluate the kidney anatomy and make the diagnosis of hydronephrosis. It also may look for the underlying cause, including kidney stones or structures that are compressing the urinary collecting system. Treatment of hydronephrosis depends on the underlying cause. If stone is the cause, then pyelolithotomy or ureterolithotomy is done. In case of aberrant vessels, transection of the ureter and anastomosis in front of the vessel is done. In case of BPH, transurethral resection of prostate is done. In case of urethral stricture, urethroplasty is done. In case of phimosis, circumcision is done. Surgery is indicated in case of pain, atrophy of kidney, nephrosis, or any infection if present. And cortical thickness, if adequate, is equal or more than 5 mm, then preliminary nephrostomy should be done to decompress the system. Reassessment of the renal function to be done after few days. If renal function improves, then depending on the cause, definitive surgery for hydronephrosis can be done. If the renal function doesn't improve, then nephrectomy is done.